let's talk about going chartless. Let's talk about the process, and let's talk about what we're going to talk about today is chartless in a world where we're now looking at how little we can touch things. So chartless is a whole new world in the world of Corona. So we're going to talk a little bit about both parts of that. And I always start with kind of telling everybody when it comes to going chartless, my story, how I started doing this. When I worked in a dental office, way back when dinosaurs roamed the earth, um, I had charts. I started with charts, and I started it in a office that had a mess of charts. And because of my OCD, I went through the process of cleaning up those charts, making things as neat as possible. I mean, I'm proud of the fact that if you look at those shelves behind me in that picture, that's pretty much how my shelves looked. I would actually peel the stickers off of charts if they weren't on straight. So if anybody's been around dentistry long enough to remember those chart stickers, that's exactly what I would do. I would get things as clean as possible in my office. But that was the entire size of my office. It was tiny, literally two chairs, and our reception area, a bathroom, a lab, the doctor's office, a sterilization area, and that was it. And everybody wonders, with the size of the office, where did we have our charts? Well, our charts were actually we were actually in an apartment building, and our charts were down the hall in another apartment that we rented. So we actually had not only our suite for our dental office, but we had another an efficiency apartment, yes, with a sink and the stove and all that kind of stuff, for just our charts. It was nice because we had a second bathroom outside of the bathroom that everybody else used that we could use privately, but it was literally a second apartment in the building. So we were paying twice the rent in order to have charts. So that was a picture of our chart room. And it was just like that. It was just a room full of charts, other than the active charts that we had, that I had behind me. But that was our chart room. In 1998, I remember it very well, May of 1998, I decided that was ridiculous and I was getting rid of the charts. This was leading up to Y2K, and we were already computerized. We were using Eaglesoft. I think we were in version 3. It was still called Chairside and Select back then, and we were using Eaglesoft. But I had already made the decision to get rid of this chart room and to go not chartless, but to go through using the computer to document all the information in the computer. And the way that I did that was I came up with some processes. I don't know if most of you guys who know me know that I'm always working on processes. How can I make things easier? How can I make them better? And the process that I came up with was, one of my doctor's friends was ex-military. He was an ex-Navy dentist. And what he had was racks of rubber stamps that you would ink up and you would stamp into the patient's chart, and they would have a grid that you could then mark information on that chart. So it's kind of like the ancient version of auto notes. So I started using those, and I would start stamping into the chart. And as computers got a little bit better and we started getting better printers, what I did was I actually went out and bought Avery labels, and I created those Avery labels for procedures, and they looked very much like this. And what I would do is, when a patient came in to have a procedure, I peeled off a amalgam label or a composite label or a crown label or a denture label, and I would stick it in the patient's chart for the doctor to fill out as he went through the procedure. So that was what we went through. We evolved from rubber stamps to stickers. Then what I finally did was I evolved to writing patients' notes in Word Perfect. So if anybody's old enough to remember, prior to Microsoft Word or whatever else you might be using today, Word Perfect. And what I would do is I would write patient notes in Word Perfect. So every patient had a document. Every document had a folder with the patient's name in it. So I was doing the same things that we did with paper charts, but I was doing it within a computer program. So we were actually writing our patient notes in Word Perfect using the formats that we had created through these labels and through these stamps. So that was the process I did to go from a paper chart to a computerized chart at the beginning. And it was a crazy process, but I had to get rid of that file room. And that was the process that I went through. So I know we're all talking processes, and we're all kind of going through a bunch of different things. So I want you guys to realize that that was the process I started with back in the, prior to 1990. All right. And it was crazy because I had to figure out how to take all of the information in the patient's chart, photos, x-rays, EOBs, allergy stickers, the odontograph, the chart, financial information like checks and payments, and then the referral information. How do I take all that information and get
Excuse
that
me,
into the
Andre.
computer? Yes.
A lot of people can't get in for some reason now.
Ah, okay. There is, if I didn't see any, I'm looking at my Facebook page too. I didn't see any note about that. There is a new link in the Facebook group. I just resent it in the Facebook group. So tell them if they could check there.
Okay, thank you.
Yeah, I don't know what happened, but there's definitely a link there now.
Okay, thank you.
Thanks, Caleb. So anyway, yeah, so I had to take all of these things and get those to put into the computer. And I had to find a way to make all this stuff happen. So, and for those people who will be getting into the call later on, I'll circle back to kind of talking about this in a little while. But what I want you guys to realize is all of this information back in the early 90s was kind of hard to get into a computer software. And what I was trying to figure out is, with all of the different things that were coming out at the time, how do you get those things to go into an existing software like Eaglesoft? How do you get those things to go in? And we'd gone from a DOS-based software, which obviously there was no imaging involved, into the computer system as it stands today. So a lot of that was just really getting over some of the hurdles that I ran into with dentistry. At the same time, this is when I started my consulting career, and I started going out helping other doctors make this transition. And this was literally a transition. A lot of it was just getting over the fear of making the leap into a computerized system. All right. Let's see. So I always use this example, and I've used this piece of clip art since I started doing this. This was what I ran into. The stubborn mule of an office manager, of a dentist, of a hygienist, of a dental assistant, of an office manager, who were basically saying, this will never work. This will never work. You can't do this. There is no way that you can do this. There is no way that I can get my information into the software. And there's no way that I'm ever going to be chartless or paperless. There's no way you could ever do that. And I said, there's a number of instances where almost every practice has run into a situation where you've gone chartless for some reason, but let's define that. There's a difference between paperless and chartless. So paperless means not generating or storing any more incoming paper. So that means you're not going to put paper into a folder or into a paper chart. All right. Or chartless, where there is no chart existing at all, and you're getting rid of the charts that you have now. So those are two terms that I kind of use when I'm thinking paperless as opposed to chartless, because now I believe that we are never going to really run into a situation where we're not going to have paper. Patients are always going to walk in with a piece of paper. They're always going to request a receipt. They're always going to request something for their flex spending account. So we're always going to generate, or we're going to have paper, but we're not going to store that paper in a folder someplace. So that's two different ways that I look at it: paperless, chartless, paperless, chartless. And I want you guys to realize that, I may be splitting hairs about this, but it means something different when I look at, is it chartless, or is the office chartless, or is the office paperless? So just so you understand the terminology that I'm going to use as we talk about it today. But I think a lot of offices have run into this, because even if you didn't want to go fully chartless, you've had, and this is a perfect example of an office that I went into where it was completely flooded. And really what they had at the end of the day was one chart, because it just all stuck together and it became one single piece of chart. All right. And it was sad, but this was an office that called me and said, hey, we need to figure out what we can do about going chartless. We have no more charts. Well, this is a very difficult situation. If anybody's ever been in a situation like this, it's miserable, because the only thing you can do is build it from memory, or build it from what you have based on the computer system that you have in the office now. And I'm going to keep talking process because as we go through this, you notice I just posted something in the Facebook group about how we make the transition to go chartless. All right. What is the process you're going to do? What is our process now with having patients, check in the car? Are they going to fill out paperwork before they come in? What is this process? And I always use this. I mean, this is something that my science teacher used to always use in school. And I never will forget it because the example he used is most people understand that it rains. And then from that rain, all right, something happens, and then we get water that comes out of the faucet. All right. What happens in between is science, and what happens in between is process. And what a lot of people don't know is that process. So I know that there's rain. I know that there's water that comes out of the faucet. What I want to know is what happens in between. And I know it's frustrating for a lot of people in the Facebook group because sometimes they'll ask a question like, is there a report for X, Y, and Z? And I'll say, why do you need a report about X, Y, and Z? Because I want to know why they're asking the question so that I understand the process, because maybe they don't need a report. Maybe they need something else. Maybe it's not a report, but it's something out of Money Finder. Maybe it's something that we can get out of a patient master. So I ask these questions because I want to understand what's in that gray box. It's the process in order to give a better outcome. All right. So how many people are old enough to remember a folded map that you used to keep in the car? Well, that was a process. So you want to go from one place to another. You had this folded map that you pulled out and you read and you looked at a process to get someplace. The issue with that is it evolved. And we went from having a folded map that we bought at the gas station or something like that, all right, to MapQuest, where we would print a map and keep it on the passenger seat as we drove. I mean, God, that was really safe, wasn't it? All right. And the process was you went online, you found out where you wanted to go, and you printed this report. And now you had this report that sat on the passenger side, the passenger chair. And then as you drove, you kind of read this thing. Well, that wasn't really safe. But look at where we are today. Today, either we have built into the car or we have in our phones a GPS system. All right. And if anybody has used Waze or if they've used the modern versions of Google Map in your car, you get great indications of what's going on the road. Are there police ahead? Is there an accident ahead? Is there construction ahead? That's the kind of stuff that tells you more than that old paper map, because that paper map never evolved. And MapQuest evolved, but the problem is you had to print out before you left the house where you're going. And what happens if something changed along the route? So what we need to know is we need to see this stuff evolve and evolve quickly, what's going on. All right. So what I want you to see is MapQuest is fantastic for what it was. Waze is fantastic for what it is, but let's make it a step further. Let's take the information from Waze and put it into our chart. And let's make our chart work the way that a GPS would. All right. So that we can quickly see, well, there is trauma at number 8. All right. And we're working construction on number 1. And number 4 needs maintenance or gas. All right. So we can quickly see these things and understand from these icons, there's things going on in the chart that we need to look at. Now, from those things, we can move into the operatory. And when I open up my Eaglesoft and I can see, just like my Waze map, I can see what's going on with this patient immediately. So I know that they're in maintenance. I know that there is a problem. I know that there's a legal matter that we need to work on. Whatever it is, I can see as soon as I open up Eaglesoft and look in the operatory. I can see what's going on without having to worry about a lot of other information. Hopefully that analogy makes sense to you guys, because if it doesn't, you need to look a little further. And if this is my operatory, I can quickly look at this patient and see from these icons on the side, and I'm going to do left to right, top to bottom, that the patient has a hearing problem. All right, the green tooth lets me know that they're due to review their bite wings. The green TX lets me know that they have a treatment plan that's over $1,000. The R3 lets me know that they're on a 3-month recall. They have a blue shield, which means they have blue shield. And the brown TX means that there's referred services that the patient hasn't completed yet. So just on a quick look, again, instead of having looked down at paper MapQuest, now I'm just looking ahead at my phone on the dash or a GPS built into the dash, right? Because I'm quickly moving down the road and I want to find out what's going on with this patient without having to do a lot of research. It's right here in front of me and I don't need to do a whole lot more. Let's take that a step further. For our admin folks, I see that same information on my schedule. So top to bottom, I can see the patient's been checked. All right, that means the appointment's been confirmed. They're a VIP in yellow, and in my office, VIP in yellow means that they have issues with keeping their appointments. All right, so they're very important that I check on their appointment. They can't have epinephrine. All right, they have a back problem, so don't lay them back in the chair. They have Delta Dental. Their benefits are low. There are 2 people in my system with the same name. This person's a new patient. They're overdue for their bite wings and overdue for their FMX. And that's what all those things tell me without having to go read a whole lot of information. Again, I want my GPS to be in front of me on my dash and not something that I have to reach down to the chair to pick up and read. Got it? Those icons represent 3 different types of things. They are patient alerts, medical alerts, and IntelliCare alerts. So patient alerts are added just like you have now. You have those yellow boxes that pop up that says, call their sister to confirm their appointment or whatever. You have medical alerts that automatically show based on the medical history form. And then we have IntelliCare alerts, which are automatically added based on your database. If this, then that. So if they haven't had bite wings in 12 months, then we get it to show up. So those kinds of things that automatically happen. So you can have up to 10 of these icons that show up on your schedule. And here's what I always hear. Well, it's too much information, Andre. I don't want all that information on my schedule. Okay, so you don't want to see the bite wings? Take the bite wings and they'll go away. You don't want to see that the patient has a balance due? Get the money, the icon goes away. So those are the kind of things that automatically show me what's going on with the patient so that I know ahead of time as I'm driving down the road what's going on and how to take care of it. So let's go back to the operatory and let's talk about the process. All right. In school, if anybody's gone to hygiene school, dental assisting school, or is a dentist, all right, we worked at a chart that looked like this, blues and reds. And this is the information we saw. And this got muddy over time. If you had a patient in your practice for a very long period of time, this got muddy because you didn't know what you completed, what you didn't do, the reds, the blues, who knows, all right? And we did all this with a single pencil, and it was blue and red. And this is what we saw. The problem is the data doesn't tell you where you need to go, what's next, how you do it, what's going on, all right? But we can take that a little bit further because in Eaglesoft, we've got more areas in order to be able to do some more information. The problem is I see most offices, and I've been in thousands of dental practices who have Eaglesoft, all right, and don't have Eaglesoft, all right? But what I see in Eaglesoft offices is people have mimicked the blue and red pencil in their software. And I see existing, completed, walked out in blue. I see conditions proposed, referred, and rejected in red, which means I can't tell from one day to another what's happening with my patients because the colors are not being utilized. So when I set up offices, and people have probably heard me say this a million times, I do it my way and I change the colors. And I use all the colors in my toolkit in order to be able to tell what's going on with my patients. And the way that I do that is utilizing the colors you see here. So I go from having 2 colors to having all of these colors. Now, it's going to sound confusing if you don't understand it, but we're going to talk through it. So how many people have ever used a pen like this with all the hundreds of color, not hundreds, but the multiple color pens, all right? These are great because based on your mood, you can change the color, but based on what I'm looking at as the stages of decay or the stages of repair, I can tell what's going with the patient. Let me talk through why I use these colors. So imagine we are now going back to work. And in the process of from March 17th until today, the doctor decided to sell me the practice. And now I am 100% in charge of this practice. All right, what's going to happen is I'm bringing in my tools and I'm going to start a whole new process of hiring. And what I'm going to say to you guys is now that you're part of my crew and you work for me, you're going to do things my way. So we're going to go through an orientation process. So imagine today we are now employees of Andre's crew process, all right? And you guys are going to go through my orientation, and I'm going to do this in the same way that I do with every office that I work with and every employee that I've ever trained. And this process is quick and easy, all right? So you're going to learn the colors that I use in charting, and you're going to learn the colors that I use in scheduling. And it's really, really simple. All right. In my schedule, all right, I use 3 colors to represent recall, all right? And it's a recall child, a recall adult, and a new patient. Easy enough. The darker the yellow, the more we're working on teeth. When it comes to perio, the darker the pink, the more we're working on gums. That's simple. All right. When it comes to restorative, the longer the procedure or the harder the procedure, the more money I make typically. All right. So I do a restore 30 or it's 60, 90, and 120. That's it. All right. And if your shortest appointment is, 60 minutes, you do 60, 90, 120. Hold on, let me see. So somebody asked a question, when you change the color in your chart, does it apply to every computer in the office or do you have to change it on every computer? So good question. So yes, when you change it, it changes all of the computers in the office, the colors change, but some offices have set up hash marking as opposed to solid fill. So if you haven't set up solid fill, it's going to look different, but the colors will be the same. So this is something you'll have to go to each computer and change the setting. And anybody who's interested, I can show you, how to change those settings, but good question. All right. Minimize that. So the last colors that I use are blue, and blue represents dentures because blue makes me sad. So there you go. And then I use the same blue as sealants in my hygiene schedule. And then the same pink for perioscaling I use for oral surgery in my restorative chair. So now that you guys know that, and now you've gone through my orientation for coloring, and now we're going to talk about the colors in the charting. Really simple. Gray represents something that's there, it's fine, battleship gray, easy enough for me to see, easy enough for me to understand. All right, defective stuff, hot pink, just like things on clearance are at TJ Maxx. I miss going to TJ Maxx. All right. Anything that's a condition is orange, like a cone that sits along the side of the road. It lets me know that there's something I should watch out for, but doesn't mean a problem. All right. The weird thing that we have next are conditions that are in LP, which means no longer present. And the only thing that typically happens where you have a condition that is no longer present would be like an abscess that the patient's had the endo and the abscess is resolved. And I color those like ghost bluish gray. So they kind of look the way they would look in a radiograph. So we have all seen endo that's an abscess that's now been resolved, but we still get that halo effect at the end of the tooth. All right. So I use that bluish gray color. All right. And then for proposed, I use green because green in my world means go. Or if you really want to be serious, green means money. So that's what I use for my proposed. For completed, I still use blue because as an homage back to the pencil, I'll still use blue. For referred, I use brown because referred services are crap I'm not going to be doing. All right. And then if somebody says I'm never going to get that done, then that's red. All right. So now you guys have seen the colors that I use in my chart and the colors I've used in my schedule. All right. You've gone through my entire orientation when I hire somebody in my offices. All right. So let's look at why I pick green over red. All right. There is a real reason I do that. And that reason is because one means problems and the other means solutions. And I utilize my chart to show my patients. So I have a big monitor at the foot of the chair so my patients see my chart. So I can say to a patient, Mrs. Jones, the things that are green are the things that we need to do. Green means go in our office. And as you see those greens turn blue, you know that they've been completed. All right. That's a simple thing, and it gets patients involved in care for me, and it helps me to get better outcomes on treatment plans. So that's the way I use greens over greens over reds. And people can say, well, I like red, I'm going to use red. Red's fine. I don't mind. If you're going to use red, go for it. But you're not going to get the same success I do. But this is the other thing. Red's only a problem in situations like this. Have you ever worn a red shirt to Target or Staples and had somebody ask you for help? All right. So red is only a problem when it's conditional. So, if you think you want to use red, use red. It's up to you, as long as you can differentiate one from the other. Now, you guys have gone through my hiring test. I'm going to put you to my hiring process. Now I'm going to put you to a test. So, my colors of my schedule. All right. Anybody want to unmute themselves and tell me what I have scheduled this day, just based on colors? I'll give you a chance. Nobody unmuted themselves. All right.
Hey, Andre, do you have restorative in there?
Yeah, in the doctor's columns. Yep.
Woot.
So what do you see?
Yeah, those are the 120 restorative, right? Oh.
Yep. So in theory, if you look at the schedule, what do you think? I've got 2 crowns scheduled in the morning. I've got a small restorative appointment scheduled at 11. I've got an emergency at 12:30, another short restorative at 12:40. All right. And you can see now, if you look at my hygiene chair, I've got a checkup, an adult checkup at 8:30, and then one at 9:30, and then one at 10:30. All right. Do you see those blocks around 9:20, 10:20, 11:20? That's where my exams are happening. I have SRP coming in at 11:30. The box around 1:30 is where the doctor's going to do an injection. All right. So that's how simple it is for you to read my schedule, because I can quickly use simple colors to tell what's going on. All right. Now, you guys, if those who answered the questions, you passed my employment test for scheduling. Now let's go to the employment test for charting. Can somebody tell me what's going on with this patient? Anybody want to take a stab at it?
Andre, at number 3, there's an implant placed and a restorative crown and abutment needs to be placed on it. A 4 needs a crown existing on 5. 9 is a watch. 14, patient has wait, that's perio, not rejected. Completed treatment is on the lower left. He's got a lingual bar from cuspid to cuspid on 22 through 27. Crown on 29 needs to be done. Existing crown on 30. Number 30, the wisdom teeth are impacted.
You got it. So this is a great idea. And this is what I want you guys to see. When I utilize the colors, I can see more. All right. And I'm going to go deeper on this because there's so much here to see that when you're used to seeing it, it actually works to your advantage. Does anybody notice the little lines around number 28? Well, that lets me know that that tooth has a mobility issue. All right. Number 14 is a crown, but remember what my color is for crowns, for conditions. So that crown is defective. All right. So I know that there's something going on with that crown that I can dig deeper to find out what's going on. So let's talk about processes again. All right. And one of the things I really want you guys to work on, and there's a thread that we just started in the group on this about processes. Again, I go back to my science teacher and talking about rain and how that comes out of the faucet, and what's in between is more important. So right now, I really want you guys to think about your processes when it comes to what we're going to be doing with our COVID-19 processes. You know, how do we treat patients as they come into the practice? Because that's going to be a big part of where we're going with this. Now, this is kind of where I've been doing. I've been doing this as, you know, as icons and showing people how to create a flow chart so that I can understand what happens. So here we go, where a patient completes their information at home online. All right. They drive to the practice, they get to the practice, they call us and they say, I'm here. We check them in and we collect copayment. That's a credit card. That's not a really good icon, but we collect a copayment. And then they're met by a staff member who takes them into the operatory and they get treatment done. We schedule the services, and then that person checks the patient out, and then they get back in their car and they go home. I think everybody in the office needs to create a flow chart like this so that you understand the processes so we all are on the same page. Because when we get to going back live, one of the important things is going to be that we are consistent with the way that we do this and that we modify it based on some of the things that happen during the day. If you're a pedo office and we've got too many parents coming to the back, what do we do? What do we do in this process and how do we make this better? Okay? So, you know, and again, you can modify my idea any way you want, but make sure that you guys have a process in place to make this happen. All right. One of the things that, and I was on a webinar on Monday with Alex Nudell and with Jeff White from Revenue Well, and one of the things they were showing, which was pretty cool, and I've seen it a bunch of times, but I love seeing how it works real time. And Jeff and Alex actually did this real time to show if you use something like Revenue Well Forms, imagine if the patient completes the information ahead of time and they're completing all of their paperwork ahead of time, signing the forms, signing the consent forms, all right, making all these things happen so that now when they get to the office, boom, they're ready to be treated. All right. They call in and they check in from the same software and it's all completed. I love that. All right. And if anybody doesn't have Revenue Well, on Monday's call with Revenue Well, one of the things that we worked out is if you don't have Revenue Well and you're interested in something like a system that will work on patient communication plus the forms, Revenue Well is doing a special offer for 30 days free for not only Revenue Well, but Revenue Well plus forms. If you're in the group and you use code Andre30, so if you call Revenue Well and say, hey, I was on a call with Andre and I really want to try Revenue Well, can I get Revenue Well using this code Andre30, and you get it for 30 days for free. So if you haven't used use Revenue Well and you thought about it, or if you're using some other crappy piece of software, if you're using something else, consider looking at Revenue Well, and you can get it on me for the next 30 days. It's a great process. So let's talk about what happens when the patients get to the office. All right. And, I'm a big fan of, again, coming up with processes. I do not like the glass shields that are going to be at the front desk, but we have to do what we have to do. But if you guys come up with processes, there's some great things. I'm a customer service, that's what I teach as a profession. One of the things I love is having a table when the patient comes in with masks laid out. And I would only put a couple out at a time because people are going to snatch them and go, but put out a couple at a time, and with hand sanitizer and those kind of things as patients come into the front door. All right. So imagine I drive up to the office, I've checked in over the phone, and I get there. And of course, this is the way I'm going to look because I haven't put on real clothes in a long time. So this is the way I'm going to come into the office. All right. And then of course you give me a mask, and then somebody comes from the back to check me in. All right. But I've already done all that over the phone, and all I need to do is go to the back and have my treatment done. All right. And again, I want you guys to work on your processes so you guys get this down. All right. We go into the operatory and now we're ready for treatment, right? Here's something I want you guys to do. Have you considered making sure that you're changing your auto notes so that they reflect the new protocols that need to be in place? So we all know that there's been a lot of talk online about the fact that we can now charge for PPE. My opinion, it's a very bad idea, but if you want to, you are required to note why you're charging for it, which means what you're using that's different than your normal procedure. So you need to mark that you're using an N95 mask, a shield, disposable gowns, all the things that are going to be above and beyond your normal procedure. All right. The other thing is, if a patient's being accompanied by somebody, if Mrs. Jones comes and her daughter comes with her, you have to make sure that you're noting that who accompanied the patient into the operatory, and that you gave that patient a mask in order to be in the operatory. All right. And then you want to show any other things that you've done that are different, like if you did a if you did a pre-procedure rinse, you want to make sure you're making that as part of your auto note. All right. And then the last thing you want to say is that you've advised the patient that if they ever show signs or symptoms within the next 14 days, they have been informed that they need to advise the office. That information is, if you need this screenshot, make sure you let me know. I would be happy to send you this, but you need to update your auto notes to include these things. All right. All right. But I don't want to make this complicated. I mean, this is the cockpit of the space shuttle. This is overly complicated for what we would be doing. This is not what we do in a dental office. It doesn't need to be this difficult. It needs to be as difficult as it is for you guys to drive your car on a regular basis, all right? And again, the analogy I'm going to use for this entire presentation is the fact that your office needs to run like you do when you drive your car. It needs to be set up so that you reach just within a few inches of where you're sitting in order to be able to pull up the information you need. And for me, that is my GPS. My GPS, and I travel all over the country. You know, I spent 50 weeks last year in hotels. All right. And every time I get to another town, I typically don't, it's my first time in that town and I have no idea where I am or what I'm doing. So what I need to know is, based on my GPS, where the good restaurants are, where the taco places. That's what I'm always looking for. All right. I need to know all this information right from my GPS. All right. So I want you guys to have that information on hand and be able to readily get that information into your system. And how do we do that? Back to the chart. So we talked about this chart a couple of minutes ago and what we saw in this chart. And Vicky was great about being able to go through here and actually pick out the things that we can see. And it gets easier and easier and easier the more you utilize it. The more information you see, the more information you can utilize. Now, let's dig deeper. All right. If you see an eye on your chart, see that red circle on the eye next to 3? That lets me know that there's imaging attached to that tooth, and it shows up on the side. Those people who have DEXIS and you're using DEXIS through DEXIS imaging, you're not going to have this integration. But if you use SHIC, or if you use something where the images are integrated into Eaglesoft through advanced imaging, you're going to see it right there. So I look at number 3. Like Vicky said, there's an implant placed there. There's a custom abutment and a crown to be done. Well, easy enough. I can look right there at the top of the screen and see that there is an image for the implant bottle. Or if you guys scan the implant labels or whatever you guys do, I have it right here in my chart. All right. Now, remember, most of the people who are in this call utilize SmartDoc. All right. And what they utilize SmartDoc for is to store this information. The problem with it is it's the equivalent of using MapQuest. And that information is on your passenger seat and you've got to go reach for it as you're driving. To me, that's dangerous. It's a waste. It means that you've got to figure out more information in another place in order to find that information. So for me, I want it right on my dashboard. I want to be able to see it as I'm driving. And anybody has ever driven with me, I'm doing 90 miles an hour and I want to be able to drive and be able to look at my GPS and listen to my music as I go. All right. So I want to be able to look over there and go, okay, number 3 has an implant. I can see, and I can't blow it up for you guys right this minute, but I know that that's a Brennemark 3.5 millimeter implant. Guess what? I can tell from looking at the screen what French system I need in order to be able to do it. I can see the cone beam slice. I can see the letter that originally went to the oral surgeon to ask him to place this implant. All right. I can quickly tell what's going on. Now, I'm going to take that red circle and slide it to the right so that you can see that there's an N next to the tooth number. That N lets me know that there's a note attached to that tooth. Now, the best part about that is I don't have to read through all of my progress notes in order to read a note just about this tooth. All I have to do is right click on the tooth, go to history, and there's the history of the tooth, and I can read my note about that tooth. All right. So if there's history on that tooth, or there's been some notes written about that tooth, it's going to immediately show up based on the fact that I can, that I linked the tooth number, just like you would linking a tooth number on a PA to that tooth. So I can quickly read the notes and understand what's going on. The process is the same as it was way back at the beginning of time when I talked about that I used a stamp and I used a label in order to be able to write the notes about the things that we're doing in the office. It's a simple process, but getting there, it'll take some time. But once you're used to it, you can quickly go through your system and you won't have to go a bunch of different places. And guess what? If we're not talking about grabbing paper, clicking on the mouse, moving around things, it's a whole lot easier, and there's a lot less cross-contamination. Now, let's talk about the notes. There are different types of notes in Eaglesoft. There are auto notes and there are smart notes. And if you use auto notes, fantastic. If you're on version 20 or 21, you can use smart notes and it makes it even easier. because now what we can do is we can click on the auto notes button. It brings up a list of all of our auto notes. I have smart notes now, so you can see all of my notes have been written out that say SN for me for smart notes. Again, I most of the things that I do are because I have a lot of OCD tendencies. And if you notice that my notes are written with a D, which means they're doctor notes, then it says SN, so I know that they're smart notes, and then the procedure code so that I know what codes go with the notes that I've written. I also have them colorized. So blue notes are for my restorative, my dark purple notes are for hygiene, and then my green notes are for my new patients, and my red notes are emergencies. Okay, somebody asked me, will this be recorded? Yes, it will be recorded. I'll make sure that there's a link in the Facebook group. So yes, it will be recorded so you guys can see it later on. And if you guys don't know, there is a YouTube channel with all of the videos of all of the videos that I've done. So if you go to YouTube and search my name, and those who don't know how to spell my last name, it's Andre, Shirdan, and you'll find it under my name. But if you go to YouTube and type in Andre Eaglesoft, you'll probably find it there too, if you can't remember how to spell my last name. So, but here's auto notes, and I'm just going to open up an example of an auto note so you guys can see. Actually, it's an auto note with smart notes in it. So that's kind of the easiest way to explain it. So I'll click on a composite so you can see my standard auto notes and how I've incorporated my smart notes into those. So you can see that I do some pretty detailed notes, but you can see that it says patient presented for composite restoration on tooth numbers. All right, and then where it says custom, it gives me a prompt to actually type in the tooth numbers. All right, because I want to write tooth, I might write 18DO, 19O, whatever, and it's not forcing me to have to pick a tooth number on a surface. I can freeform type that pretty quickly. But you can also see that it's including blood pressure. It's including who accompanied my patient into the practice today. And again, for my COVID-19, that's a very important part of this. But again, with COVID-19, I want to say if the patient actually came back into the operatory with them. All right, but this is how I write my notes, and each of those things you see within the brackets is let's call it a hyperlink to a smart note. And what that is it's a choice list. So once you have something like, and I'll click on this anesthesia, this is what would happen when you clicked on anesthesia. It gives you a list of all the anesthesias that you use in the office. And this is not something that Patterson set up or Eaglesoft set up or I set up. It's something that you would set up yourself. So I set up a hyperlink for anesthesias, and then all the different types of anesthesias that we use in the office, including one that says no anesthesia needed for this patient. All right. So you create these sort of hyperlinks that you make as part of your auto notes. All right. And here's a shameless plug. If you didn't know it, I wrote a book on progress notes, and all of these templates are in this book. This was supposed to go on sale April 1st. And because of what's going on in the world, I decided I am not selling it. It is available to anybody who wants to have it. There's, just like if you were on PBS, there is a donation if you'd like to make for as little as $10, you can get the book. So the link is on my Facebook group, and I'm sorry, not on my Facebook group, on my website. So if you go to andresaidso.com/book, you'll find a link or a way to get the book. There is a progress notes book, and there is a collection of all of the Eaglesoft how-tos in a separate book. So there's a couple different things available. All this stuff was supposed to come out on April 1st, and I decided I'm not selling anything to people who aren't working. So it's out and available. If you guys want it, it's an option. So just so you know. So let's go back to charting examples, because I told you I wanted to go through these charting examples, and I wanted you to see some of the things that you saw in my chart. And remember, here are my colors. So I'll give you a little refresher on my colors and what they mean. Now let's look at some charts. All right. So does anybody have any idea what's going on with this patient? Anybody want to unmute their phone and tell me what you see in this chart? Oops, sorry, it went back. Anybody want to guess? All right. All right, I'll do this one if nobody's going to try. So what I'm looking at now is this patient has or had at one time full bonding and bracketing. See the brackets on the third molars? All right. They had orthodontic extractions. See 5, 12, 21, 28. See how the teeth have been removed, but the space is closed. See the arrows closing the space. All right. They have crowding on their lower anteriors, and there is a lingual bar from 22 to 27. That lingual bar is detached at 24. All right. And if you notice the invisible line, I know that sounds weird, but the invisible line under number 1. So think, and it's green. Green means proposed to me. So they have proposed Invisalign. So you see how quickly and easily I can look at a chart and tell what's going on with a patient. Again, my GPS, I know exactly where I'm going and what needs to be done and what construction is along the road. All right. This lets me know based on those drawings. So let's try another one. All right. Anybody want to try this one? If you want, unmute your phone. Unmute yourself. And if you want to take a stab at what's going on with this patient. And this is great for anybody who is starting some new procedures or starting new things in your office. And if you don't know, so the same thing, those gray teeth, 5, 12, 21, 28 have been orthodontically extracted. All right. This patient has a sleep apnea problem. So you can see in the center of the mouth that they have a CPAP that they're wearing. The M3 is a Malin-Potty score. Malin-Potty score is a score based on the way the patient breathes. The orange circle in the middle lets me know that they have a airway abstraction issue. And whoops, sorry, I keep going backwards. All right. And if you see the line under number 1, it lets me know that they're wearing a snore guard or sleep guard. All right. So again, the more information that I can see on my screen, the easier it is for me to work on a patient. How about one more? How about this one? Anybody want to take a stab at this one and tell me what you see in this chart? I'll give it a couple seconds. And I don't see anybody unmuting themselves, so I'll go through it. All right, so somebody asked, do you custom make these or are there templates available? So there are some examples in the field guide for how to make custom draw types. What you see here are ones that I've made doing. This has been 20 years of me making custom drawings. So I actually can do them outside of Eaglesoft and bring them back in. I'm probably the only person in the country who can really do them this way. But you can do them yourself. You know, they don't have to be as fancy as mine, but you can certainly do them on your own. And there are some examples in the Eaglesoft field guide. If you just type in custom draw types, you'll find some examples of how you can do these, especially the lingual bars. Those are easy. So anybody want to stab a guess before I answer these?
Andre, I'll take a stab at it.
Go for it.
Okay, so the whole lower arch is an implant-supported fixed bridge work.
You got it.
There's an existing implant crown on number 11.
Yep.
Screw
retained.
Okay. 3, 4, 5, 13, and 14 are existing, missing, and they probably have a partial denture, would be my guess, but I'm not quite sure.
That's it.
Okay. 7, 8, 9, and 10 have veneers.
Yep.
Because there's nothing on the lingual, and we have completed a veneer on number 6.
You got it. Now, weird thing. Do you know what the number, what the lines are in the 11, and then that 11 that goes on to 12?
No.
So 11 has bone grafting, and 11, 12 have a sinus lift.
I should know that one, Perry.
Good. You get. I'd send you a sticker, but you just got one.
I know. You can send me another one. I have multiple computers.
I'll do that. All right. So, but again, guys, this is, the more you know, the more you see, the better it is for you. And again, just like what you see, what's happening with Waze when it first came out, and now what's happening now is they're starting to put coupons there. So if you drive by a Dunkin' Donuts, you can start to see that there's a coupon available there. So, the more you see, the better it is, the easier it's going to be for you to be able to be chartless. So any pediatric office is in here. This is a great way. So I do a lot of pedo and I do a lot of charting in pedo. So B is ankylosed, C is gemination, T has had, eight has had trauma, which means it's non-vital and it's been discolored. There is a supernumerary at 9. 11, the primary tooth is there, but the permanent tooth is erupted too. There's hypocalcification at G. There's a stainless steel crown with a pulpotomy on J. So again, the more I see, the more information I need, and this is what I'm talking about, the more you can do. So another question, can we still use this method of charting if we've been using another method or charting previously, or will it go through off all patient charts? Yes, so if you change your charting system, it's not going to screw up too much, because anything you've done in the past will change going forward. So again, if you change your colors, all things are going to change going forward. So it's not a big deal to change. So if you've used red as you proposed and now you're using green, it's no big deal. For charting purposes, if you add a build-up drawing, which the build-up drawing in Eaglesoft is not very good. It looks like a crown. But if you add that build-up retroactively, it's going to change every single patient who's had a buildup and add that buildup to them. So if that's the question you were asking, hopefully that answered your question. But yeah, anything you add goes retroactive, and sometimes it works, sometimes it doesn't, because depending on sequencing too. So if you've done implant under a denture, if that implant was done first and then the denture was done second, the denture is going to be on top of the implant and it's going to hide the implant. So you won't even see it. It'll work, but you won't even see it. So it depends on the procedure and it depends on how it's done. But if you add things, they do go retroactive, and it goes back to the beginning of time. It'll show anything that's ever been done. So hopefully that answers your question. So let's go to the next one. I think that's the last example. But the question I also get, and somebody sent this to me when I started talking about doing this webinar, the question was, how long does it take to be chartless? And that depends on the office. I think the hardest thing to make the transition to is progress notes. But the way I look at it is, if you start progress notes like this, if tomorrow you say, we are no longer going to write in paper charts, we're going to do it in the computer, then if you use this method, which is on the first note, you make a note like this. This is the first entry I have on Sally. Sally's been a patient in our practice for 15 years, and Sally has had a history of this. We completed a bridge on the upper right, Imagine if you were writing a note to a colleague, an office that you liked, and you're writing a note about a patient. We're going to be sending Sally to you, and Sally has been If you write a really good note, all right, then when the patient comes in at 6 months, there's absolutely no reason to look at the paper chart, because the note that you see in your computer describes the patient so well. Then in 12 months, you definitely don't have to pull the chart. And in 18 months, you really don't have to pull the chart. So the better you write the first note, the better you write the first charting, create the first charting, the less you'll have to ever pull the chart again. And I'm sure people have gone through this process where you realized, it's almost like you took an FMX on film and then you started using digital. And after a while, there's absolutely no reason to ever look at that old film FMX. So the more information you put in the first time you see a patient electronically, the less information you'll ever have to get afterwards. Got it? So let's talk about soft tissue charting. If there are any hygienists in the group, or if anybody has assisted a hygienist with doing charting, that was one of my favorite things to do, is to help a hygienist do charting. To sit there and call off numbers, it was just, as an OCD person, it just made me feel good. But in your perio charting, there's a lot that you can see, even though we were looking at hard tissue a little while ago. Now, so if you click on perio in the operatory, it's going to bring up, not that, but it's going to bring up your hard tissue first. I always make people start from hard tissue. All right. And we want to include perio by using this. And I don't know if everybody's ever used this, but down on the lower part of the chart screen, there is a button that says show what. All right. And I want to show some things on the hard tissue chart that we don't typically see, which is soft tissue. So I'm going to hit that, and I'm going to include my perio information on my hard tissue chart. So I'm going to include the gingival margin and the mucogingival junction. So if you look on my odontograph on my chart, if you notice that 14 has a crown that is hot pink, and again, in my system, hot pink means defective. So this patient has a buildup of root canal, but they have a defective crown. Now, what would a defective crown be in my office? Imagine the patient is 85 years old and they have porcelain that's been chewed off of this crown, but the crown is serviceable and the patient's healthy otherwise, and there's no reason to replace this crown other than for aesthetic reasons. I'm just going to leave it alone. So let's look at this patient's chart, superimposing the perio, soft tissue, on the hard tissue chart. Now, let's see what happens. Do you see the blue line? That's the gingival margin or recession. Do you see the green line? That's the mucogingival junction. So now when you look at that crown on 14, you'll know why I don't replace this crown. So if I replace this crown, there's a lot of work that has to be done. And this person's 85 years old and the crown's fine and they're okay and everything else is good, and we've taught them how to clean that area very well. I'm not touching that crown. So it could be like that for the rest of their lives. All right. But once I include the soft tissue on the hard tissue, I can see a whole lot more of what's going on. And again, this is what I'm talking about building on this GPS so that I can see more and more information. All right. So not only can I see that there's construction, but I can see what the construction is. They're fixing potholes or whatever. So I can see more information just like we do with a regular GPS. All right. So let's go back to our perio chart. And when we open up a perio chart, we typically see a blank chart. Now, there's an option. I can also see all the charting from the previous visit. And that's what I want to see, is I want to see what the patient looked like on the previous visit in order to start doing a new chart. And that Eaglesoft gives you two options. And the comparison is this. I can open my chart blank, or I can open my chart with information from the previous visit. And within File Preference Perio, there is an option right there that says use previous perio data when starting a new exam. So again, the way you want to look at this is it's like you just took a photocopy of the previous exam and now you're just writing on top of it. So it doesn't affect the original exam. It's just an update to the information that's already in the chart. All right. So you're using previous perio data when starting a new exam. All right. And this is a great tool because typically I see offices who on a first visit, they'll do furcation, mobility, gingival margin, recession, et cetera, and then the next visit, they'll do spot probing. The problem with doing spot probing is it won't bring forward the recession because you're not doing recession that time. But if you start with previous data, it will keep that number there of the recession and the gingival margins and the mucogingival junction and carry that information forward. So you always want to utilize this tool in order to bring the information forward from the previous exam. All right. Now, let's talk about how we can get this information into the system easier. So typically we're going to be probing that information, probing the patient and finding out what those measurements are, and somebody else is helping us to put that information into the computer. Okay, that's all well and good, but sometimes we don't have enough staff members in order to make that happen. So an option, for about 20 bucks, we can do something that's really simple. We can buy a numeric keypad and we can put this in the operatory either on the bracket table cover right over the patient or whatever we can do. I actually had somebody who came up with an ingenious way. They took some Velcro and they created a leg strap, and they actually strapped this numeric keypad on their leg. And what they do is they take their periodontal ruler, not a probe, periodontal ruler, and they put a finger cut on the back of it. And what they do is as they do their measurements, they use the back side of the probe in order to be able to type in the numbers. So it's a one-person job. So all they're doing is measuring, using the back end of it to tap out the numbers, and it goes so much faster than having to turn in their chair to a keyboard. So just a quick, easy way for $25. These numeric keypads, you can get them wirelessly, you can get them wired, and it's a great way to be able to do perio charting with one person. All right. There are other options. I don't know how great they are. There's voice activation. All right. And I will tell you, voice activation is not the greatest thing in the whole world, but if you want to try it, voice activation is built into every Windows computer. All right. So go out and buy yourself a headset. If you've got a Bluetooth headset, you can actually go out right now, put your Bluetooth headset in the computer, get yourself a little Bluetooth dongle. They're about $10. Order it on Amazon. All right. And you can start Microsoft speech recognition, and you can try perio charting. You can try doing your progress notes through voice. It works really well, but we all know it's just like your car. If you open the window while you're driving and you are trying to talk on your Bluetooth, it's not going to work really well. And we have the same exact thing in the operatory, which is wind noise. And that's what hurts voice activation. So you can certainly try it, and it doesn't cost you anything. If you've already have a Bluetooth headset, then you can get a Bluetooth dongle, or if you've got a headset you can just plug into your computer. If you've got a kid who has a PlayStation and they've got a gamer's headset, try it, see what happens. Plug it in and see what happens with voice activation. It's a great tool. There's some other things on the market, like the foot pedals that are out there. I've yet to be able to utilize one of these that I liked. I had one for about a week that I tried. I thought it was a little too cumbersome. And in most operatories, there's already too much crap on the floor. So you tell me if you like this or not. But there are other options to be able to do perio charting. But I like my little $20 numeric keypad. It works really well. And it's fast, easy, and I get a lot done. Here's another thing you guys might want to look into. This is something that I've been talking about for years. The keyboards that are washable. Yes, we cover our keyboards, but you may on a regular basis want to find a way to clean it even more, because I've seen some pretty skunky keyboards out there. So you can look at Seal Shield. Their keyboards actually can go in a dishwasher along with their mice. They can go in the dishwasher, but even Logitech sells a really inexpensive keyboard that you can wash. So something to look at when we are going a little bit more in depth with the way we're updating and cleaning our operatories. So just a couple options to look at. So let's talk about some other things in charting as we start to wrap this up. So charting conditions, all right? So conditions in the office are going to be things that, this is the easiest way for me to put it, all right? And sorry if I offend anybody, but this is the way I'm going to put it just for the sake of this analogy. Conditions are the things that come from above, or that happen naturally. So abfractions, impactions, let's see, those are abscesses. Those are conditions, all right? And conditions can go away over time. Impacted wisdom tooth doesn't go away. Typically we extract an impacted wisdom tooth, but an abscess will resolve, and that's where you saw me using condition no longer present. All right. Let's talk about referred services. So referred services could be something like, this is a referred extraction. The problem with this is this referred extraction. So say I refer this extraction to my oral surgeon, and now the patient comes back, and now that extraction is existing. So it would go from looking like this to looking like this, because existing in my office is gray. The problem with that is it looks like the patient presented with an extraction. So I don't like doing it this way. So I actually have a separate drawing that I use for any referred extractions. So I show them like this, so that when the patient comes back from the oral surgeon and that tooth has been extracted, now it looks like this. So the difference is, if I have an X, I can tell it's an existing extraction, patient presented with that extraction existing, as opposed to an extraction that was referred out and now is existing. So it's semantics, but it's easier for me to tell that that patient get this extracted by, before they came into the office, or was this a referral that was then completed? All right. Let's talk about the difference in the watches as a condition or watches using the right click add watch. So if you're looking 8 and 9, 8 and 9 in the center of the screen have exactly the same condition. All right, they're a watch. I'm watching the mesial incisal of both. But 9, I can't see what I'm watching. I'd have to right click and view the watch. Or with 8, setting it up as a condition, I can immediately see what I'm watching, the mesial incisal. There's no reason to right click, view the watch, change the watch, write something in there. I set it up as a condition, so it's quick, easy, simple. I can see it immediately as soon as I look at my chart. All right. So if you like the yellow bar, go for it. I only use that yellow bar in my office for showing soft tissue issues, like a lesion or something like that, or somebody burning the palate or something like that, eating pizza. But I'm not going to use that to show something that I can show as a condition. Got it? Any questions? And you guys, if you have a question, you can send it through the chat at the bottom of the screen, or if you want to unmute your mic and ask a question. I just want to keep an eye on the time as we do so. I see somebody unmuting themselves. All right. And if not, we'll have some time at the end, all right, to go through. All right. So let's talk about navigating. Again, GPS, navigation. Let's talk about getting around the screen. So what I'd love for you guys to do is clean up your toolbars so that there's less clicking, less things that you have to do. If you can see the top toolbars, I've got 2 toolbars up there, and about 90% of the things that are on there, I might never, ever use. All right. So what I do is I clean this up so that I have one toolbar based in an order that I like and set up with descriptions that make sense to me. Because like if you're a new user of Eaglesoft and you're used to calling your account screen the ledger, so you can right click on that account icon and rename it ledger if that makes it easier for you to get around. Again, I want to make this as easy as possible to get around this. Somebody asked me a question, so let me make sure. Can you give that web address again? So the web address is www, I'm going to type it here, www.andresaidso.com/book. And my email address is thecrewprocess.com. There you go. Oops. And I typed it out there, but I should have sent it to everybody. There you go. So I put it in the chat. So anybody who asked that question, you've got my website and my email address. So that's the information. So anyway, I want you guys to clean up these toolbars. And here's an inside tip. Is changing the toolbar still per person? Yes. So good question. So yes, changing the toolbar is per workstation, but here's a tip that you guys need to know. Once you get it the way you like it at a front desk computer or an admin computer, you can call Patterson and say, I need the copy preference utility. You can run the copy preference utility, and then you can copy those preferences onto every other admin computer. Then you go to one clinical workstation and you set it up the way you like it, run the copy utility, and copy that clinical workstation to every other clinical workstation. It's a fantastic tool, and it used to come on the CDs that you got when you loaded the software, but we don't do CDs anymore, so it's not available anymore. But if you call Patterson technical support, they can help you download it, and they can talk you through the process of doing that copy paste. It's a great process. Okay, so I had another question was, can I go over the paperless walkout again? I will certainly do that. Yep, I'll definitely do that before we finish up here. And those people who had the question about how to set up these toolbars, if you go to the FAQ page on the Patterson support page, the FAQ is 1122.1. So if you have a question about how to do that, easy enough. It's on the page there.
Andre, I have a question.
Go for it.
We were discussing going chartless in our office the other day at a staff meeting, and one thing that we were concerned with is about in the back, trying to do everything clinical. We're referring a patient, we can use the e-referral and send everything out to the referring dentist, the x-rays, the images, the referral. do you have to have a separate email account set up on each operatory computer in order to do that?
Well, two things. E-referral does not work anymore. Yeah, e-referral wizard, which was an option, Eaglesoft will not send anymore because it's not HIPAA compliant. So it can only print. You can generate an e-referral and it will print to paper, but it will not send. So it's a great management tool, but it's not an option to send anymore.
So there's no way for the assistant to be able to finish up with that entire patient, refer them out, refer the images, send the images and x-rays all from the clinical operatory.
No, not anymore. Now it has to be done separately, but you can actually create a print template where just like your the endodontist will send you that form with a tooth on it and how the patient did, pre-op, post-op images kind of thing. You can do something like that with a print template. But if you remind me, I'll send you a link in the group to do that.
Okay.
But yeah, the e-referral wizard is dead in the water.
Of course.
Sorry. Yep. So I had another question that came in. We save to SmartDoc and then send via email. Yeah. So yeah, that kind of answers what I was saying. Yeah, you can save it to save it to SmartDoc and send it. And again, there are templates built in where you can actually have referral templates set up so that you can save to SmartDoc and then email the SmartDoc. But you only have to have, to Vicky's question, you only have to have one email. You could just have that same email address open and send from every workstation, and your IT people can set that up. It has to be either Outlook or you can use Mozilla Firefox. Mozilla Thunderbird, sorry. Mozilla Thunderbird has to be MAPI compliant email, and only Outlook and Thunderbird are MAPI compliant. So those are options to send from within Eaglesoft, but you kind of want to build the template first and then email the template like Kristen said as from SmartDoc. Build it, save it, send it, and that's an option.
One more question for you.
Go.
We were talking about having assistant be with the doctor the whole time and doing the notes all at once. What happens if an assistant has to come in and take over? Do they need to log out of the system, log back in, and then they finish up the note on that patient?
Well, here's the thing, because I know this, the Vicky who's talking right now, you're in California. One of the things that California requires is that charts are signed, and I'm putting that in air quotes. So what I've been telling a lot of offices they can do is the assistant can write the progress or the procedural notes. So, and I have this set up in my auto notes. The procedural notes are done by the assistant, and they can do everything under their login. The doctors can then go to their own computers and then log in and sign the notes. That signature in California is their name, so they can use a drop down, pull up their name, and then they have to physically type in their license number, which is almost like if you signed your taxes through TurboTax. All right, it's kind of like in order to do this, if you put your birthday in it, you're signing that's you. So that's what I have people doing, is actually doing two separate notes. One is procedural, what was done during the procedure, and then a secondary note, which is comments from the doctor along with their name and their license number. So it could be a separate login. Assistants can log in the operatory, do all their stuff, and then doctors can do it from their operatory, or they can do it even under the login of the assistant. No big deal, because they are physically typing in their license number. So it's not a perfect world, but that's it. That's what kind of the workaround I've been using in California for the offices I work with out there. Got it? All right. So let's do this. Let's talk about how I'm going to get this paper into Eaglesoft. And the way I do that is I get a piece of paper. All right. I stick it in my scanner. All right. And I open up advanced imaging. So most of you guys are putting this stuff into SmartDoc. I'm going into my advanced imaging, and I'm going to right click, and I'm going to say, scan it into Eaglesoft. and then I'm going to tag to the tooth number. You see I have it tagged to tooth number 1, and now it's part of my record. That is so much faster and easier for me than it is to be able to scan it into SmartDoc, save it into a document group, give it a name, save it. And the problem is it takes forever to find it. So if I scan it right into this information, it just automatically becomes part of the record and attached to the tooth number. So it's a faster process to get it into the system to me. All right, let's talk about quick picks really fast. So I want you guys to quickly set up your quick picks, and I want you to make sure that they're clean and easy to read. All right, so that this is fast. The ADA stopped calling exams years ago. Exams are called evaluations. All right, so you want to go through the process of renaming all your exams so it's very clear and easy, so that anybody in the back, if they don't understand codes, they can look at this and go, evaluation periodic, evaluation limited, evaluation comprehensive, evaluation depth. They're very, very quick and easy to use. All right, so those are the things that are on my exam button. All right, on my imaging button, I don't take film, so why should it say 18 films? All right, I do images. So all of my imaging is broken up this way, and it's very quick and easy to read. All right, that's my imaging button. Then on my adult prophy button, as quick and easy as it can be. All right, I don't use the word prophylaxis in my office, but you can see how quick and easy it is for me to read what I'm doing. It's professional cleaning. All right. And then on my child button, and you can see what's on my child prophy button. All right, quick, easy. All right, and all these things are in the field guide for how I set up my quick picks. All right, now here's my crown button, and you can see that I've got crown Emax, crown insertion, crown gold facing, crown porcelain all ceram. All right, I have my crown set up so that there's no question of what we're doing and how we're doing it. All right, it's really quick, easy, and I want my people in the clinical area to be able to just click, grab, go. All right, now I want you to see these first 3 things on my drop down for my crown, and I have period, CBU, which is a crown and a buildup. I put a period at the beginning of the exploding code and the period at the beginning of the description, so it's at the top of my list because of the most commonly done procedures. So I have a root canal buildup and crown, and a root canal post and crown, and I have a crown and buildup separate. So I have those 3 things so that I don't have to keep clicking. All right, that's why they're called exploding codes, because they explode into those 3 codes or 4 codes. All right, and then here's the setup for my exploding code. And you can see that I have a root canal, I have my buildup, I have my crown, and I have the crown insertion, all as one treatment planned procedure. All right, and I would have this set up for the ones that you send to the lab. And if you do in-house milling, then you don't need to have the insertion for this. All right, but you want to set this up so that it's set up so that you can just quickly grab and go utilizing exploding codes. And here's my denture exploding code. And you can see all of the steps that I would do for a denture are included, so that once I create a treatment plan for a denture, all of my wax ups, my try-ins, my deliveries, and then my post-delivery adjustments are all included, so that for me, writing a treatment plan takes 1 code. All I have to do is put in period DENT, and I've got my entire treatment plan for a denture included in 1 code. All right, and that's on the drop down that I have for dentures. All right, so let's talk about smart codes. If you noticed in my root canal, post-and core, and crown, I only have 1 root canal code on there, because guess what? If I choose the right, tooth, it's going to give me the right code. So that's set up utilizing a few things. In our preferences, we have to make sure that use smart codes in walkouts and treatment plans is set up. We have to make sure that when we go to our service codes and we look at our root canals, all right, let's edit one of them. Like, let's edit the anterior root canal. We want to go over to chart setup on the right. All right, and we want to make sure that all 3 root canal codes are showing, so that if I choose a 1 canal tooth, if I choose tooth number 9, it gives me a 3310. If I choose a bicuspid, it will give me 3320. If I use a molar, it gives me 3330. All right, then that's how you make smart codes work. In that, think about this. on all of my denture button and my partial button, the RPD is removable partial dentures. On those two buttons, I only have uppers for everything, which means I have 50% less codes on my drop downs. Because if I choose lower teeth, it'll give me a lower denture. If I choose upper teeth, it'll give me upper denture. So I only have a 5110. If I choose lower teeth, it'll change to a 5120. So all I have set up on those drop downs are my upper teeth, and then I don't have to worry about doubling the number of codes that are on those buttons. Less mistakes, less time it takes to do those code setups. All right, questions about that? And if you guys have questions, I know I wanted to make sure that you guys get any questions that you have in. So if you have questions, just stop me. So let's talk a little bit about alerts again, because I think most of the people that are on the call are admin people, because I see a lot of the names and I know a lot of the people who are in. So let's just talk about, again, the Waze apps gives us things that we know on a quick glance what's going on. I want you to have those things on your schedule. So here's my patient alerts, and you guys already have alerts in your system. I know it because I have the offices I go in, I see them. So immediately, if I look at Rick, I know this patient, there's 2 Rick Smiths because I've got that little twin icon. I know this particular Rick is wheelchair bound. So I want to make sure he gets an operatory 4. All right, these are patient alerts, and you probably have alerts in your system now, but I can actually see these things on my schedule. Rick speaks Mandarin, believe it or not. So I have to make sure I have somebody who can interpret from Mandarin to English, because I don't speak Mandarin. All right, and Rick has a problem with keeping his appointments. All right, so I can quickly see those through patient alerts. All right, I have medical alerts. So based on the medical history form, anytime he checks off anything on the medical history form, and we have that in our system, so I have a latex allergy. I have that he's taking a bisphosphonate. I have that he's had a hip replacement or a joint replacement, and that he's a smoker. So I can quickly see those things based on the medical history form. And the last thing would be IntelliCare alerts. And those are, just like I said, if this, then that. So if they haven't had bite wings in 12 minutes of the day, I get that green tooth. If they have a balance over X and it's been X period of time since they've made a payment, I get the green or the red VIP. If they have a remaining benefits of less than $200, then I get that battery with the low battery icon. And if they have Delta Dental, I get my Delta Dental symbol to show up. And you only get 10 of these icons that show up, and you can pick and choose which ones are important to you. I wouldn't have some things like smoker on my schedule. I'd have that in the operatory, so that's not necessarily what I would typically do. But this is an example of the options that you have available to you. All right, but you can utilize these things, and a lot of the options for doing this are in the group, and a lot of the icons that are available are also in the file section of the group. So anything that you need, let me know. The other thing I want to let you know is IntelliCares can slow your system down. So you have to be really careful and thoughtful about the way you utilize them. So be aware that IntelliCares, if used incorrectly, can really slow down your system. So you have to really pick and choose which ones you want to use and make a choice. All right. And here's a quick setup for how to set up the IntelliCare. It's under List and IntelliCare. All these things are in the Facebook group, but here's a quick one just to show you that I set this up so that if a patient hasn't had bite wings in 12 months and a day, I get a green tooth that shows up on my schedule. Now, the one thing that you see at the top of this, my description, is to review the need for bite wings. The patient doesn't need bite wings. It's time for me to review to see if they need them. All right. So I make sure that everybody knows that. So it doesn't mean they need it. It just means it's been 12 months and it's time for me to check them out to see if they need them. All right. And for there is an icon that you can have if the patient is missing a photo. So if you've been gathering photos for patients, you can have an icon that shows that there's a photo missing. All right. And that little icon down there lets you know that you have a photo. And what I do in my office is I scan driver's licenses. So I always have a photo of my patient, because there've been so many times when people have said, oh, I don't want to take a photo. I'm about to go to the hairdresser. Do you have to take a photo? I don't even bother. I just do like the physician's offices do. When the patient comes in, I ask for a driver's license and a insurance card if they have it, and their credit card. And I scan their driver's license and I scan front and back of the insurance card if I want to, but I make sure that I put the information in the system this way. A lot less pushback for asking to take a photo of a patient when I can just scan a driver's license. All right. And then from the schedule or from any place else in the software, we can always just drop down our imaging and we can scan the driver's license. And I use these little card scans. These are really convenient to use. All right. So I scan it right there into my software and now it's part of the record. All right. So let's go back to my file room and let's talk about a lot of people on the front of the chart. They used to have like a little plastic window where they could put some notes about the patient, you know, patients going to Disney World or patient's daughter's getting married or those kinds of personal notes. Well, you can have a private memo about the patient in Eaglesoft. All right. So why not put this information in the software so that you can utilize it and get it when you need? Because back in the day when we had all these labels and stickers on the chart, it made it harder for us to find the information, or if it was a Post-it, did it fall off? I mean, that was really kind of something that we dealt with on a regular basis. All right. So here's another thing we want to talk about as we're wrapping up here. Last visit and the last images that were taken. All right. So this is an important piece of information to know when the last time the person was here and when the last x-rays were taken. So we have that information that shows, so why don't we better utilize that? Down here at the bottom, this shows me the last FMX, the last bite wings that were taken, and the last Panorex that was taken. All right, those things get messed up sometimes. And a lot of times it's because of the way that the codes were set up. So you have to make sure that when you edit your codes, like for an FMX, that it's actually set up right here to show when the last FMX or bite wings Panorex was taken. All right, so you have to make sure that you edit those codes, the bite wing codes, the FMX code, the Panorex code, to make sure that they are set up to show the last time somebody was here, and also that checkbox under Pro-Fee and perio maintenance for the last time the patient had a recall visit. So make sure you're checking those boxes and making sure that the system will update, because if that box for FMX is not checked, it's not going to show the last FMX that the patient's had or last bite wings the patient's had. So make sure you're checking that box. All right. All right. And here's what I tell offices: make sure that your imaging templates don't update the last bite wings, the last FMX, and the last Panorex, because there have been a number of times where I've gone to offices and the office has taken a couple of PAs in a bite wing mount, or they've taken a few images, a few images in an FMX mount just for the convenience, because they were, horizontal and landscape, and they take them in an FMX mount. If that FMX mount is set up to update the last bite wings and the last FMX, it's going to say the patient had an FMX, even though you just took a couple of PAs in an FMX mount. So just be aware that we want to make sure that the imaging templates are unchecked for bite wings, FMXs, and Panorexes, and that those updates should come from when those codes are actually charged out based on the code and not on the templates. All right. Here's another thing. Hopefully some docs. I saw there's some docs in the group. One of the things that I want you guys to do, and I thought about this as I was going through this presentation, I want you guys to look at a couple things. A lot of offices save money by getting inexpensive monitors. I'm big on technology, and one of the things I want you guys to see is this is a monitor where nothing has been done to this monitor. All right. Now, I don't know if you noticed it, but I just made a change to the monitor, and you might not have noticed it, but I'm going to just do half of the monitor and show you what the change looks like. All right. Do you guys notice the line down the middle of that monitor? You notice the right side from the left side of the monitor, and you notice the difference in the left side to the right. So the left side is really clear and the right side is a little muddy. Well, the reason that is because a lot of times people will buy monitors that are made for word processing. And those monitors have a sheen on them so that it takes the eye strain off. But the problem is it takes away some of the color, which if you're looking at an X-ray, it will muddy the X-ray. You won't see a clean PDL. You'll see a lot of things that are not clear. So make sure that if you get a monitor, you're getting a very good monitor. And then once you get a good monitor, here's a tool. Go look for this. Get on Amazon and buy yourself a spider from Data Color. This is what I use on every monitor in my house, and I've got a ton of them. And what this does is it normalizes the monitor based on a color grid, and it makes every monitor perfect. And it's the best thing in the whole world for looking at x-rays. And this is what I would do when I was helping people with digital x-ray. I would use this, and I carry one of these around in my bag, and I set this up on every monitor so that every monitor is exactly the same. It's called a data color spider. And if you find the Spider 3 Express, it's really cheap. I got them for like $50. All right. So last thing we're going to talk about is the schedule. And I told you my schedule, and I showed you my colors, and I showed you what it looks like on the schedule. All right. And as easy as it was for you guys to see my schedule at the beginning with one column, this is what it looks like as a full schedule. And again, what I want you to be able to do is not have to read a lot of stuff. I want this to be like a GPS. I want you to look at the screen and know what's going on. And you should be able to look at my screen and tell you exactly what's happening in my schedule. We know that there's an emergency coming in at 1 o'clock. We know that we've got Crown and Bridge in the morning in the first operatory. I can tell that I'm doing SRP on all hygiene patients at the first of the morning. All right. So you should be able to quickly look at your day and tell what's going on based on this. Now, there's another option. We can switch this over to look at what the providers, which providers are doing what. And it's a simple thing. At the top of your schedule, you have an A over P button. And the A is for the appointment types, and the P is for the providers. So before I was looking at appointments, and now I'm looking at providers. So this is a quick, easy way to solve a lot of issues, because if you look at the last column on the right, and you notice that my provider is yellow, but the last person scheduled is purple, well, that lets me know that that patient is scheduled with the wrong provider. So at the beginning of the day, if I fix that, my walkouts are going to get so much cleaner and easier. But the other thing is, you notice there's a blue line at the end of that, which means that first doctor in the left column is supposed to be doing that exam. But I know that that doctor ends his day at 1 o'clock. So something's wrong, because he's got 4 patients in the afternoon who he's supposed to be doing exams on. So just by using that AP button, I can solve a lot of the problems that are going to happen with walkouts at the beginning of the day or the day before as I'm confirming appointments. So just something quick and easy to look at is that AP button. If you're not utilizing it, utilize it to see where your scheduled patients are and who the providers that they're scheduled with are. All right. So remember your employment test. If you got that right, you did really well. All right. But let's see how we can get rid of route sheets. All right. And I always use this example when I talk about route sheets. If you've got an iPhone, all right, and you've got an iPhone in your bag or a Galaxy phone, all right, I doubt that you're also carrying a address book. All right. And if you're carrying an address book and you have an iPhone, then we've got to have a conversation, because do you carry a stylus? I mean, I don't know anybody, as many people as many of these things as they sell, I never see anybody with one in their pocket or anything like that. If you've got a stylus, there's an issue, because what I understand is with route sheets, everybody tells me they have to have a route sheet. I have to have a route sheet. I have to have a route sheet. And I go, why? What do you utilize it for? And they go, well, there's information that I need to see. And I go, okay, let's try that. So you need to see that the patient has insurance. Guess what? I see what kind of insurance they have right on my schedule. I need to see that patient has a balance. Guess what? I see all that information right on my schedule. All right. I need to see that they have low benefits. Well, I see that right on my schedule. All right. I need to see which their preferred provider is. Well, I see that right on my schedule. All right. I need to see that they have some sort of comment. And this is an icon that I built for an office where they have a dog that walks around the office. And that means the dog is not allowed in the operatories when the patient's there. So I can see that all on my schedule without having a route sheet. All right. It's as simple as this. I can see all these icons in my operatory or on my schedule based on what that alert is. And if you build this, you don't need the route sheet. And with what we're going through now, we don't need the cross-contamination of having that paper go from front to back. And as somebody who worked at the front desk, I definitely don't want that piece of paper coming back up to me. All right. So let's eliminate the route sheets. And we can find ways of doing it. I can show you a million different ways, but I doubt that anybody who walks up to somebody in the mall who has an iPhone is saying, oh yeah, let me pull out my pen and paper and write down your phone number, as opposed to being able to type it in. It just doesn't make sense to me. And just think now what kinds of germs are going to live on that pen. So let's get away from route sheets and let's figure out another way to do this. All right. Somebody asked me about membership plans. I'm just going to quickly talk about this. If you've got a membership plan in your office, great. If you don't have one, now's the time to start considering it, because as patients come back to the office, a lot of people have lost their benefits. Or if they haven't lost their benefits, a lot of people are reconsidering it. So think about having membership plans in your office. I think they're a great tool. And I do three different types of memberships in my office: gold, silver, and platinum. My gold plan is just any basic plan that you would have in your office. It includes the 2 checkups a year like most people do, and it's a 10 to 15% off. My platinum plan is really just a perio plan. It includes another visit, and these are just general ideas of what it would cost. All right, and then my silver plan is a no-charge plan, and it gives a smaller discount, but this is what I give to my senior citizens. So they still pay for their checkups, but everything else is at a discount. But the beauty of this is I can really get them into a membership plan and create some rules about those plans. So here's a sort of template that I use, and just want to show you a couple things that are here. My plan has 2 little rules in it, which are: if you go 30 days beyond your scheduled recall interval, you lose your plan. All right. And the other one is, if you cancel more than 3 dental appointments, you lose your plan. So I build those into my plan. So even if I gave the plan away to my senior citizens, they now have to follow my rules. All right. And I turn them into a cash patient. So if you haven't considered a membership plan, now's the time to do it. And let's do this. I've got about 15 minutes. And why don't we do this? Anybody who has a question, open up your, you can unmute yourself and ask away, or if you want to send a message through the chat, you can certainly do that. And I'll give you the as much time as you want. And if you need to jump off the call, you can, but I'm here for the next 15 minutes. If you have any questions, ask away. And while I'm waiting, I'm going to go back to that screen about the process, because that was a question somebody had. And the walkout process is where I'm trying to get back to. The walkout process for Eaglesoft has got to be something where the back and front are working together, which means the back is utilizing post to walkout. All right, so in the back, what we're doing is the service is on the schedule. We're right-clicking and posting it to walkout. And then what happens is at the front will see that, and then they'll actually complete the walkout. And Sarah Yates from Maine, who's also a technology advisor, she's in the call. Sarah and I did a webinar on doing the perfect walkout, and that is also on the YouTube channel. So I know we're kind of talking a little bit about it now, but there's a full video about how to do a perfect walkout on there. There's a bunch of videos on how to set up employers there. So if you guys have questions, there's a lot of things there. I see you, Sarah. Hey there. So any questions, you guys let me know. Vicky.
Yes. We were talking about trying to get updates for medical history. Yep. And being contactless with this new COVID trying to reopen up, and was wondering how we can do that in the operatory.
Okay, so this is an opportunity to update your entire medical history to include the COVID-19 questions. I think this isn't going to go away for a while. I think the questions and the answers that we get from people are going to still be valid for a little while. So it's a good time to actually update the Eaglesoft medical history form, so that it's just another question on the list. It's also a good time to clean up some of the things that we really don't care about. Like, did they take fen-phen? I mean, nobody's taken that since 1980. So it's a good time to actually go through and update some of your medical history forms to actually include some of those questions. That's the way I've been approaching it. You could create another form, but it's going to be disjointed from medical history. So it's a good time to just actually add it as a question, do a custom medical history form, and you can create icons that go along with it. So you could have like the little COVID germ thing like everybody's using, make that an icon and have it show up in your schedule, or not in your schedule, but in your operatory.
Actually, what I was referring to was we have not gone paperless yet. So
Okay.
they do updated health history actually on paper. So how can we get them for them to fill out questions, answer them themselves, and sign it?
So your only option, and again, this is going to be based on a couple different things. If you told me that your average patient is my age and older, and you know my age, so my age and older, all right, then you might, this might be a time that you're going to have to do paper. And, if you look at the studies, the germs last longer on plastic, rubber, and metal than they do on paper. So, you might want to look at actually having the form on paper, having them fill it out. I'm talking if they're older, or looking at a kiosk check-in, which is something I just posted something. You can actually have a kiosk computer, or with an iPad in it or something like that, or you can send them to a website so that they're doing the stuff online. Lots of different options, but the problem is if you're not using something like revenue well forms or something like that, then the information is going to have to be transcribed into Eaglesoft. So no matter what, if they're doing it on paper, if they're doing it on some third-party software, you might have to still transcribe it in order for it to be an alert that shows up. But like if they're doing revenue well forms, then it's automatically going to populate the fields and automatically show up. But other than that, there's no easy way. I've yet to come up with something other than to have somebody sit down at a computer, fill it out like a kiosk, or give them paper. There's just no other easy way.
Okay.
You could do it as an interview process where hygiene is going through through a medical history with them, or the doctor, and saying, are you taking any medications? Have you been recently hospitalized? Are you pregnant? And then going down that list, checking off those things, and then having a signature pad in the operatory that they can sign off on. But ergonomically, you could have a problem because if the computer's behind them, how are they seeing what they're signing? How are they knowing what they're signing? It's, that's where it becomes an issue. But an iPad, a Surface tablet could work. Lots of different options like that. You could have a Surface tablet that you could have Eaglesoft loaded on, and you could actually hand them the tablet. You don't have to have anything special. You use fast check-in to do that. It's a lot of different options to do it that way, but nothing's simple. I wish.
Of course.
Yeah, I wish. Somebody asked, okay, about upgrading to version 21. Can you put the questions in the chart auto nodes so you don't have to reformat the history? Yes. So, and again, I mentioned this about my new format of auto notes include a lot of the COVID-13 questions. But again, questioning, if I ask somebody the questions, have you traveled outside the country? Do you, have you been exposed to it? Those kind of questions. And I type the answer. It's not the same as like what Vicky's asking about if you're getting a signature from somebody. So, because, I remember the days of AIDS, and I'd say 90% of the patients who I knew who died of AIDS or AIDS complications never wrote in their medical history that they had HIV or AIDS. So, and the one person who I knew, who was a personal friend, who was a patient of the practice, who had HIV positive, who advanced to AIDS and passed away of it, even on his last visit where he was full blown, did not write in his chart that he had AIDS because he didn't want the stigma attached to it. But we knew it. We were actually, the office, our doctor actually helped him to diagnose him. But he never wrote it in his chart, but we knew he had it, so. And Velma said, yeah, you can have two medical histories at the same time, one for children and one for adults, you can add another one for COVID. The problem is, again, multiple forms, the problem is they don't populate the alerts in the same way, and the information's on two different pieces. But yes, you can have multiple forms in Eaglesoft at the same time. So you could have a normal medical history form and then a secondary form just for COVID-19. I think this is the time to just clean them all up. And if you're going to do a custom form, you might as well create a whole form that works for you, because now's the time to ask the questions of, do you have clicking, or do you have pain in your jaw joints, or do you any of those kind of things. So this is the opportunity to add those questions about sleep or whatever else you might be doing in your office. So for me, it's an opportunity to update the office. So any other questions, anybody? If not, we got about 5 minutes and then we'll wrap it up. And I really appreciate you guys being here and being part of the crew. Let's see. No questions there. And, this is a good opportunity. I don't know when everybody's going back, but my sense is that a lot of people, especially in my area, are not going back until at a minimum June 1st. This is a great opportunity to reach out to your local technology advisor, to have somebody come in and actually work with you. And a lot of them are doing dial-in visits where they can dial into your office to help you out. I'm doing a lot of dial-ins with offices, but my thing is I help with philosophies and changes and not with the day-to-day stuff. So make sure you guys are helping with that. Post a link for print templates you refer to. The link, I'll post in the Facebook group the wording that I use for the COVID-19. I don't know if that's what you mean for the print template that you're talking about. So if you can clarify that question a little bit better, I can help you on that. But not sure what you mean about the print template. But I'll post my update to auto notes in the Facebook group as soon as I get off the call. Anybody
Hey, Andre,
else?
it's Sarah. How are
Hey,
you?
Sarah. Good. How you doing?
Good. I just had a quick question.
Go.
What are your thoughts about people using fast check-in in their practices? Have you heard some?
I think fast check-in is slow, but other than that, I like fast check-in if it's done properly. And I
Right.
think if you do it with, and I've gone so far as go online and actually order a kiosk that they typically sell for hospitals. It's a freestanding thing. It's almost like the things that you see in a mall where you go up to get directions. They're about $1,000, but really what it is just a really good covering for a computer, and it's a touchscreen. You can get one of those for about $1,000, $1,500 and have it in your reception area so that people can check in using fast check-in. And if you're just utilizing it to update information and add these new questions, it's a great tool. So fast check-in is good for a lot of situations, but the issue is if you've got a family of 4 coming in, that's where it becomes slow.
Right. And then the other question that I was thinking is, during this pandemic with COVID, are we going to see more offices kind of step away from having a computer in their waiting room and a little kiosk?
Well, the problem is, I think just in the same way that they could be using an iPad, those things can be cleaned where paper can't be cleaned, clipboard
Right.
can't be cleaned, but you could come down in between patients and wipe down a kiosk. And if you're using one that's hospital grade, obviously they've been created to do that. So there are some that are built for this. I don't think we've ever run into a situation where we've had something like this where because like I said, I've lived through the AIDS epidemic, and we never had to deal with anything that was as crazy as this, and with the restrictions that we have. All right. So, this is one of those things where I just don't have a good answer, but I think fast check-in can be used in a certain situations. I have offices that have computers in their reception area. There's a picture in the Facebook group of a couple of offices that I have that have check-in stations for fast check-in, and I don't think those offices are going to be able to utilize those right now because they're literally sit-down stations with keyboards and mice and computers. I don't think they're going to be able to use those. So,
Right.
Yep.
Awesome. Thanks.
Sure. So, okay, the question was refer to other offices so we can, okay. So yeah, so I now understand what you mean. The referral is eReferral Wizard, and I'll put a link there for that question about how to print out the information from e-referral wizard to SmartDoc, and then you can email the SmartDoc. So I'm glad you cleared that up. But yeah, I will do that because Vicky asked about that, and now I've got another request for that. So I will tag people on that post. I'll bring the post back up to the top so you guys will see that, and I will tag both of you guys on that one. So it is 3 o'clock, so I want to wrap this call up so that I can get on to my next call. And you guys know, if you guys have any questions, you know where to find me. I can't get far away from you guys. So let me know if you need anything. Happy to help. Give me a call, send me a message me through the Facebook group. Glad you were part of the meeting today, and I will talk to you soon.
Thanks, Andre.
Thanks,
Great
guys.
job.
Take care, guys.
Thank you.
Bye-bye.
Thank you, Andre.